through scientific studies and rigor that are safe and effective, who fires experienced experts and scientists doing the research that will save lives, and installs unqualified political allies based on their fringe, unhinged ideology in positions of critical scientific leadership. He forced out CDC Director Susan Monares, a respected scientist with impeccable credentials, because she refused to rubber stamp his dangerous, unscientific, ideologically driven agenda. 4 senior CDC leaders resigned in protest, and he replaced them with individuals who push conspiracy theories and unproven treatments. That is not reform. It is the very politicization he falsely accused CDC scientists of perpetrating. 9 former CDC directors, Republicans and Democrats, serving both under Republican and Democratic administrations, have issued a chilling warning that Secretary Kennedy's actions have weakened life-saving programs that protect Americans from cancer, heart disease, infectious disease, and much more. They told us plainly this is unlike anything our nation has ever experienced. And this is unacceptable. The American people deserve a health secretary who understands and uses science to protect families, that puts the public's health above politics. Secretary Kennedy has proven he cannot and will not do that. That is why today I join the Democratic Doctors Caucus and the chorus of health professionals, public servants, community leaders, CDC workers, scientific experts, the bench researchers in demanding his resignation now. And if he will not step down, then Congress and the President must act to remove him. Our nation cannot afford a health secretary who undermines science, dismantles protections, puts lives at risk, our children's lives at risk. And we must restore integrity and trust to the Department of Health and Human Services, because the public's health is not a partisan issue. It is a matter of life and death. Thank you, and now I want to introduce Dr. Kim Schreier.
Good morning. I'm Kim Schreier, Congress's pediatrician. I have seen for decades that RFK Jr. has lied to the American people. He has spread misinformation. He has sowed doubts about vaccine safety and efficacy, and he has scared parents. And I want to be really clear that his theories are baseless and fringe, and that he cannot be trusted for 1 second. For months, RFK Jr. has let his reckless conspiracy theories guide our public health policy, eroding public trust and endangering lives. He's fired experts and replaced them with activists. Day after day, we are seeing evidence that having RFK Jr. as our Secretary of Health and Human Services is making our country a more dangerous place, particularly for children. And as a pediatrician, I cannot overstate how reckless, how irresponsible this peddling of vaccine misinformation is. I want to make it clear, doctor to patients and parents, the vaccines are safe and effective and essential to protecting our health. Unlike RFK Jr., I've actually treated patients with measles, with pertussis, with meningitis, and let me tell you, these are terrible diseases. Children suffer. They are life-threatening illnesses, and we should all be grateful that they are rare thanks to vaccines. The longer that RFK Jr. manipulates policy at HHS, the more danger he puts all of us in. He's already restricted who's eligible for a COVID vaccine. He is taking our choices away. He has reversed evidence-based recommendations that pregnant women get COVID vaccines, putting them and their babies at risk. And now he's coming after the entire childhood vaccination schedule. Based on his actions so far and his tight ties and financial interests in the anti-vaccine industry, it will not be long. I do not believe it will be long before we see more outbreaks of measles and pertussis, meningitis, and maybe even polio. Yes, polio could come to the United States of America. And let me just add that Florida's cancellation of school vaccine requirements is only going to add fuel to this fire. These and other vaccine-preventable illnesses will once again get a significant foothold in this country, and every one of us should be scared. I am so proud to join my Democratic doctors and my colleagues in standing up for our constituents, standing up for public health, and calling seriously, forcefully, for RFK Jr. to resign immediately before more children get sick or, God forbid, die from diseases that could easily have been prevented. And with that, I'd like to turn this over to my colleague, Dr. Kelly Morrison from Minnesota. Thank you.
Thank you, Dr. Schreier. Good morning. I'm Kelly Morrison, Congresswoman for Minnesota's 3rd District and the first and only pro-choice OBGYN to ever serve in Congress. Thank you. I join my colleagues this morning in calling for RFK Jr.'s immediate resignation. I stand here again with the members of the Democratic Doctors Caucus 6 months after we voiced our warning about and opposition to his nomination to lead HHS. Our worst fears are now being realized. There needs to be a point in which we all stop and say, this is unequivocally disqualifying. We cannot be complicit in letting political ideologues take over our scientific and public health institutions. We just had the firing of one of the nation's top scientists because she refused to put a political agenda over protecting public health. We've had an exodus of senior agency officials who said they could no longer work in RFK Jr.'s environment of weaponizing public health for political gain and putting millions of American lives at risk. We have had a complete political takeover of our nation's top health agency. This is the truth of where we are. What we've been hearing from the federal health officials whistleblowing about RFK Jr.'s leadership at HHS is horrifying. We have to listen to what they're telling us. RFK Jr. is literally orchestrating the destruction of public health care in the United States. He is completely undermining globally respected health institutions like CDC. He is taking us from being a leader in the world to at best an absolute mockery and at worst a danger. Vaccines are modern miracles that keep us from dying of preventable diseases. After decades upon decades of dedicated work to create these life-saving miracles, he is dragging us backwards. I'm disturbed by this administration's indifference to the damage he is causing. And I am beyond disappointed in congressional Republicans who confirmed him and continue to enable his destruction of public health in the United States. If nothing changes, I worry the CDC won't survive this, and irreparable harm will have been done to public health in our country. So we must be clear-eyed about the danger we are in, and we all need to speak out. This is not a partisan issue. This is about the health of the American people. I call on all members of Congress to be patriots and stand up for the health and safety and well-being of the American people. Thank you very much, and I turn it over to my colleague from New Jersey, Dr. Herb Conaway.
Good morning, everyone. My name is Dr. Herb Conaway. I represent New Jersey's 3rd Congressional District. I've come to the Congress as a practicing internist and actually an officer working for the public health in the county where I reside. And I understand fully well as a public health officer how important it is for a functional CDC to review the science and transmit that data down to the state and down to the county where I worked. so that we might advise people on how to protect their health, advise them about emerging infectious diseases coming from overseas, what they ought to do with respect to COVID, responding to measles outbreaks. We rely on the CDC for important information on doing that. Now, coming before the Congress, I also served in the state legislature for 26 years. I served as the chairman of the Health Committee, and I've had to deal with these anti-science, anti-vax types, many of whom are driven by a financial desire as they promote wild conspiracy theories disproven over and over again, as, for example, that vaccines cause autism, disproven over and over again, and yet they continue to spout that lie, saying that additives in vaccines cause autism and other problems, also disputed over and over again. And recently, we as a group joined understanding what RFK Jr. did. I have firsthand knowledge of this because he worked in my state, trying to get us to walk away from science and to abandon vaccines. He's now brought it here. Now, he's got a record. And I am sorry that the senators in the United States Congress did not follow the advice of many, including certainly our Doctors Caucus, when we raised the alarm about what he is going to do if he becomes the head of the most important health apparatus in the world. CDC, our colleagues who are working in Medicare and Medicaid. We have seen the disaster that he's wrought, and we warned the Congress about it, and sadly, they refused to listen to his own history of lying and spreading misinformation that is directly harmful to the health of many citizens right straight across this country, and indeed will impact people worldwide. I hope when they bring him before the Senate today that they will remember that he lied to them when he said he would not remove the FDA's Vaccine Advisory Committee members, and then when he gets into office, what does he do? He fires every single one of them and puts on that committee known vaccine skeptics who again, are interested in stoking misinformation so that they can go to the courts, so they can make money giving speeches and putting money into their own pocket, and they're willing to sacrifice the health of so many in order to do it. Now, we've already seen him ignore a measles outbreak across several states in the West. 1,408 people have died when I checked this morning, contracted measles. When I checked this morning, 3 people have died. And what did he do? What did he fail to do? He failed, as any expert would tell you, get in there, get people vaccinated, arrest and stop the progression of measles virus. He did nothing. And the virus continues to spread. And what these vaccine skeptics fail to tell you, as they advise you to take vitamin A and do other things that won't help, that there are many, that 1 in 1,000 children who contract the measles virus will end up having a subacute encephalitis that could cause long-term cognitive disabilities and other issues related to their health. This is a serious condition. So they don't want the protection of the measles vaccine to prevent children from getting measles in the first place, leading to more deaths just this year than the last 25 years. This is what this man is bringing. And just think about this attack on the childhood vaccinations that he is bringing forward. Rubella, a vaccine which causes congenital birth defects. We give this vaccine to children, not only to protect them, but to protect their mothers and other women who might give birth. And if they contract rubella during pregnancy, they were very likely to have a child that is so severely damaged by the virus that the child won't live. These things have been proven time and time again. He's shown who he is. Ideology has no place in the process of determining and developing the best recommendations for how we can protect our health. We could have another pandemic. We've seen viruses in recent memory out of the Middle East that caused 25% of the people contracted it to die. Now, we didn't have the mRNA virus then, but with that virus, the technology that the vaccine brings will allow the world to vaccinate everyone at risk in a year's time. Just think of what that could mean in terms of arresting a pandemic that can cause so much death and dislocation. And we're cutting the funding from it, and we're walking away from this science-based intervention. Now, I join, of course, my colleagues in saying that he needs to go. He has failed in his principal duty to protect the American people. We're sitting here in a situation now, again, ideologically driven, where we are defunding health care. We are seeing the resurgence of diseases which were nearly eliminated. I'm surprised they don't wax poetic about the good old days of polio. That's how misguided these people are. He needs to resign. He needs to go. The Senate needs to do its job. And hopefully with your help, we'll keep the pressure on until the clear and present danger to not only the health of Americans, but the health of the world leaves the stage once and for all. Thank you.
Thank you. Thank you so much. I got to tell you, I want to thank all of our speakers, but I really love the Congressional Doctors Caucus. I mean, the expertise, and many of y'all do stuff with 314 Action. You do stuff with Protect Our Care out in the wild, not just here in D.C. So I want to thank all of you. That is our final speaker. I know these members will mill around for a minute if you have questions. But 314 Action and Protect Our Care have been on the case since the minute Donald Trump announced that he was going to appoint RFK Jr. We're going to stay on the case with these members, with the Senate, continuing to make the case what a threat RFK Jr. and Donald Trump and the Republicans who confirmed him are to American health care and to public health. But I think the message that you heard from several of these speakers from the Congressional Doctors Caucus also needs to be relayed. Don't listen to RFK Jr. Don't listen to the anti-vaxxers. Don't listen to the pseudoscientists. Listen to the Doctors Caucus. Listen to your doctor. Listen to the scientists. Thank you all for coming, and we'll be in touch soon.
Thank you. Really appreciate you being here. Oh, you're really good at this, huh? Fired up. Yeah.